What impact do new variants of the virus responsible for COVID-19 have on vaccines? COVID-19 vaccines that are in development or have been approved should provide at least some protection against newer variants of the virus, as they elicit a large-scale immune response involving a set of antibodies and cells. Therefore, changes or mutations in the virus should not make vaccines completely ineffective. In the event that these vaccines prove to be less effective against one or more variants, it will be possible to modify their composition so that they confer protection against these variants. Data collection and analysis on new variants of the virus responsible for COVID-19 continues. Until we learn more, we must do everything in our power to stop the spread of the virus to avoid mutations that can reduce the effectiveness of existing vaccines. In addition, manufacturers and programs using vaccines may need to adapt to the evolution of the virus responsible for COVID-19. For example, vaccines may need to contain multiple strains when developing. Booster vaccinations may be necessary and other modifications to the immunization may need to be made. Trials must also be designed and continued in order to assess any changes in vaccine efficacy, and these trials must be of sufficient size and diversity to allow clear interpretation of the results. Studies examining the impact of vaccines during their deployment are also essential in order to measure this impact. How to prevent the appearance of new variants of the virus responsible for COVID-19 in the future. Containing the spread of the virus at the source remains the best solution. Current measures to reduce transmission, including frequent hand washing, wearing a mask, respecting physical distancing, and avoiding crowded areas or confined spaces, still work against the new variants by limiting the transmission of the virus and thereby reducing the possibilities of mutation of the latter. Scaling up vaccine manufacture and deploying vaccines as widely and quickly as possible will also help protect individuals before they are exposed to the virus and the risk of new variants. Priority vaccination should be given to high-risk groups everywhere to maximize protection against new variants worldwide and to limit the risk of transmission. In addition, it is more important than ever ensuring equitable access to COVID-19 vaccines to deal with the evolving pandemic. As the number of people vaccinated increases, the circulation of the virus is expected to slow down, which will lead to fewer mutations. Why is it important to get vaccinated when there are new variants of the virus? Vaccines are an essential tool in the fight against COVID-19, and the use of the tools at our disposal has clear benefits for public health and for saving lives. The concern generated by the variants should not delay vaccination. We need to get vaccinated even though the vaccines might be a little less effective against some of the variants of SARS-CoV-2. We must use the tools at our disposal while continuing to improve them. No one is safe until everyone is.